Sarah Freuen-Gernbacher, and I started at Children's in October of 1987. And I don't remember meeting Liz. I think she was there when I arrived, and Liz has just always been there, both in my professional life and my personal life. And what a joy that's been. But I don't remember meeting Liz, and she would make a first impression, but I truly don't remember. She's just always been there.
I'm Mary Hall. I met Liz 29 years ago when I was the manager of the Hematology Oncology Clinic at Children's.
Liz will always find the joy, and she has a great laugh, and she will always laugh. I think people are surprised that there can be a lot of humor when taking care of children with cancer and blood disorders, and in Liz's case of the chronic illness of sickle cell and pain crises. I think it surprises people to learn how funny sometimes that kind of very personal and intimate care can be. And that is Liz's superpower. She will always find the joy, and she'll highlight the joy. She will look for the joy. She will always find the joy. That's what makes Liz Liz.
Liz is special in so many ways, but I really think when I did work with her, just watching her dedication to families and advocating for them, whatever would make their lives easier, that was what Liz was about, and that was fun to watch.
I think that when I reflect on what Liz's biggest contribution has been to the sickle cell community, it's beyond measure. It's the little moments she shared with patients where she reflected her love, her care for them. She believed in them. She saw them. She knew their struggle. I think those moments have a ripple effect that lasts a lifetime. So I think her contribution has been on a very small and intimate level, but it has probably created ripples that have affected children as they grow up and become adults and parents themselves. Those are very powerful moments. I think she fueled a lot of that.
I think Liz's ability to recognize that this population of patients and families needed to be looked at comprehensively rather than to be managed in an acute setting when they had a crisis. So to look at the whole patient and what do they need at times of crisis, and then at times when they aren't in crisis, and to provide a very comprehensive care plan, I guess, for these patients and families.
Liz is a great storyteller, and hearing Liz tell a story is just a highlight. She loves to tell stories, and she's so good at it because she pays attention to the little details about our human experience, and she loves to tell and is really great at telling a great story. We love Liz's stories.
Well, if they don't know Liz, they're missing out. I'll say that. But I think her joy for life and her just the joy that she brings to whatever she does, her laughter, that is something everyone should experience.
Congratulations, Liz. A well-deserved award. It's been a pleasure to be in a front row seat along your nursing career, and it's just a wonderful thing that you're being acknowledged in this way. Congrats, Liz.
Congratulations on receiving this award, Liz. You are a phenomenal nurse and a phenomenal person.